the main culprit. We're going to tell you what that main culprit is in a little while. But speaking about cholesterol-lowering drugs, they found out that most cholesterol-lowering drugs, especially the statins, actually not only do they affect the cholesterol, but they deprive the body, the cells of the body, of a very key nutrient, a key chemical, I think it's a protein called CoQ10, which is coenzyme 10. And that CoQ10 is essential for the strength of the heart muscle, and not just the heart muscle, but skeletal muscles all over the body. What they're finding out, a common side effect of these statins is that people get weak. Well, of course they get weak because it's depriving the bodies of CoQ10. Now, if it weakens your physical body, your limbs, that's not too bad. But when it begins to weaken your heart, which is the life pump of your body, then you have a problem. Because remember, for cells to be healthy in the body, they have to have adequate perfusion. And perfusion starts with blood being pumped out of the heart into the blood vessels. So these drugs may be causing a major problem, and which is already beginning to show up now. So, and it's unfortunate that there's this huge drive to really sell anti-cholesterol drugs. And again, this might be helping people, but at the same time, people need to be educated to know what to do to further protect themselves so they don't have problems in the future. Now, this whole thing about cholesterol, this whole thing about fat. So the other dietary thing they're saying is, well, reduce your fat intake, and that's good, especially animal fat. But if you focused only on that, you might still miss the boat. As a matter of fact, many are missing the boat because the Eskimos in Greenland, a study was done a few years ago, and the Japanese. Now, let's start with the Eskimos. The Eskimos eat a diet very high in fat, very, very high. But they also have a lot of fish. They have a lot of fish, which they take. The Japanese have a low-fat diet, but they still take a lot of fish, and they'll have other things in their diet that actually have these fatty acids called omega-3s. Now, the omega-3s, which is in fish and in other foods, the Eskimos take a lot of the fish too. The omega-3s are actually known for their anti-inflammatory effect. Now, I was going to say this, that both groups of people have a very, very low incidence of heart disease. Very, very low incidence. And again, the answer was regards to what they were taking in addition to whatever else they were doing. So, and the key was inflammation. The key was their protection from inflammation. We in the Western world are not protected that much from inflammation because a lot of our diets contain toxins, preservatives, vegetable oils. A lot of the oils that we have actually have omega-6s. Omega-6s actually are pro-inflammatory agents. In other words, they cause inflammation. Omega-3s do not cause inflammation. And why am I talking about inflammation? Well, they're finding out that inflammation, and we have a class of inflammation too, so if you want to study that some more, we have some great quotes. And do we have an MP3 on it?
I think so.
Okay. Inflammation is what really is responsible for a lot of the problems of disease, whether in terms of cancer or whether in terms of autoimmune conditions or even heart disease. As a matter of fact, one study showed that over 98% of all heart disease starts with inflammation. And there's a lot of research that's gone on there. So the answer is not as much cholesterol. Now, that doesn't mean you should go around with a very high cholesterol. It's very important that you reduce your cholesterol. But how about this? How about feeding your body giving your body the vital nutrients that it needs to regulate its cholesterol levels, to regulate its inflammation levels. You see, the idea is this. Your body wants to be well. Your body wants to be healed. and it's going to continually do everything it can to, with the limited resources that you give it, to attain that level. The level of health you are enjoying now is the level of health you've permitted your body to enjoy. And whether through your own knowledge or through your own ignorance, that is really what has happened. Always saying now is that your body can reduce your cholesterol levels if you give it the right nutrients. And of course, again, the difference is this. We're not saying stop your medications altogether. Of course not. I would be the last person to say that. But it's important for you to not rely entirely on medications, because you are not, your body does not need the medications to live. It needs nutrients to live. So use the nutrients as well as the medications, and then you can taper that off as you go along. Inflammation is the culprit. Emotional issues, depression, epidemic of anger, and hostility all raise C-reactive protein levels. What is C-reactive protein? This is one of the key markers of inflammation. In fact, if there's an inflammatory process going on in the body, you're going to find a lot of they call it CRP, C-reactive protein levels. And, of course, that means there's a lot of inflammation. So depression, these emotional things, folks, you just can't mess with them. You cannot mess with these emotional problems, issues. You've got to find a way to live a life of peace and happiness. What can you do? Well, we've alluded to things along the way. And it's all captured in our philosophy, which means start now, build strength, start getting information, start finding out what you need to do to strengthen what remains. You will always have cells in your body that know what to do. It doesn't matter how far you've gone. Your body has so much recuperative ability that it will recover. And I usually try and summarize the whole philosophy into four main things. A focused, happy, and productive mind. And of course, you can't do that if you're not doing something, if you're not involved in a career or vocation or something that is of benefit to others. I mean, you just can't. So the key number one thing is to find that sense, that purpose for your life, and that purpose for which you were born. Of course, regular diets, nutritional supplementation is important, but don't think you can get away with eating all kinds of terrible foods and not take some responsibility for that. You need to have both. Healthy living, of course, includes exercise. Very, very important. Remember, your veins, the blood in your veins, and the fluids in your lymph move better when you exercise, amongst many other things. Exercise, another thing they found out is that exercise causes over 140 different genes to be turned on in a beneficial way.
Wow, so it's more than just burning some extra calories.
Oh, yeah, a lot more than that. A lot more than that. It does improve your well-being in a very full way, a wholesome way. Of course, you need to understand, as you grow older, you're going to need the medical system for sure. But you need to understand what questions to ask. Studies show that patients who go into the doctor's room, they're so intimidated by the white coat or whatever it is, that they go in and they had questions. They had about 4 questions they wanted to ask. They get into the office, can't remember one. Can't remember a single question. They leave dejected and unhappy. So being empowered starts with having information. Okay? All right, and again, we have this picture here to show this is where we need to focus on. We have about 12, you count the blood, 13 systems in the human body. 13 systems in the human body. These 3 systems, the nervous system, the endocrine system, and the immune system, if you can focus on these, especially where your cardiovascular system is involved, you're in good shape. Okay. Next slide. Move it. Come on, folks. All right, next slide. The wonders of technology, like you say. Okay. All right. Let's go on to nutrition, okay? Yes, I got this from Dr. Reg McDaniel. This is probably one of the best quotes I have ever seen, I have to tell you. This Roger Williams, he discovered a pantothenic acid or vitamin B5, and he named folic acid. He named folic acid. What did they give to every pregnant woman? Every pregnant woman, they give her folic acid, which if pregnant babies are actually born with birth defects, in some cases with people